scenes production crew, as
Yeah,
well as
so
people too.
and I'm sorry, I for some reason I can't download the disclosure video form, so I just emailed. I can't remember who I emailed and said I'm okay with everything. I'll get them all to you, or
Okay.
hopefully I'll give you a verbal yes.
Sounds good. That's a perfectly fine. And we sent three questions ahead of time, but those are literally for you to get your brain going and thinking about the
Uh-oh,
topic.
I don't know that I saw them. Can you tell me what they are
Oh,
really
that's fine.
quickly? I'll think about it for 2 seconds here.
Really, the gist of the conversation as we go along will be I want to cover three things, right? First, whether it's your personal experiences or experiences you've heard across the nation when it comes to API hate crimes and racism.
Tons of
Second,
those.
yeah, and then second, the question is, or the topic will be focused on what is the impact on Asian communities and individuals as we think about hate crimes and racism, whether it's a physical and or psychological impact, right? And then the third one is what is the role of in because we're in healthcare at Mayo, what is our role in healthcare in the healthcare industry as we think about addressing racism, addressing hate and discrimination? So,
Okay, I got it.
but again, like I said, we may not get to all three of those topics. We'll touch on those. Depends on what it goes, how the conversation goes. Even though we may not have people, the participants, attendees, live to ask you all questions. We'll be taking Q&A and chat, and in the chat room, taking perspectives from them to pull into the conversation as well. So it is truly a conversation. We don't need, not the expectation for you to prepare any type of presentation or anything like that.
And what would and who's the audience?
All internal Mayo Clinic employees, and we have
Okay.
roughly about 500 or so live on the Zoom call.
Okay.
About 300 on
Conference recording has started.
Will be reached on the Facebook Live group, and then which is a closed group to Mayo alumni and staff, and then the conference call's recording is to our internal video exchange channel.
Okay.
And that
Great.
is also about 100 or so audience members.
Okay. And this starts at noon, right?
Yes.
Okay. So is it okay if I like jump off and come back on in a few minutes?
Go
Okay.
for it.
Thank you, guys.
Yep.
Yikes. Where is
So I do have the YouTube working. It sounds like Kabuika. I'm going to go ahead and go Facebook Live right now, and we're off to the races. Thank you.
Sounds like a plan.
Good morning, everybody, or good afternoon, good evening, depends on where in the world you are. Thank you so much for joining us today for Everybody In. Today's Everybody In session is entitled Stop Asian Hate Crimes, What We Can Do Together to Address Racism, Hate Crimes, and Discrimination. Now, normally we play an uplifting, upbeat song for you at the beginning of our conversation, and I promise that's going to come today. But before we do that at the end of our presentation, I wanted to call attention to some of the events that are happening in our world today. I started to make this slide just about some of the recent headlines in Boulder, Colorado and Atlanta, and I quickly realized that there was no way I had enough room to do all those headlines. We've had 103 mass shootings in the United States of America and Washington, D.C. in 2021 so far. So that means that 4 or more people were shot or killed in a single incident. That doesn't include the shooter. And that's a dramatic rise. Last year, we'd only had 66 by this time last year. So, you know, I'm a fact finder. So I went digging into it and looked at some statistics, and racism, Islamophobia, all the isms that we talk about is clearly involved. When you look at the data, race is a huge, huge factor. And I have to think about not only the victims of these shootings, but who we define as a victim. I'm not excusing the violent act that was done, but I have to think about the systems and the processes and the failures that put people in all of the positions in those shootings. So when we ask, you know, I'm just one person, what can I do? I thought about our listening sessions that we did for our Asian employees and folks of Asian descent this past week. And I salute all of the folks who had the courage to come out and share their feelings with us. And what can I do? What can one person do? I heard over and over, nobody reached out to me. If just one person had said, how are you doing? This is why colorblind doesn't work, because we need people to see who we are. So what can I do? I ask you to just see the folks around you, see the Mayo family that you work with. And if a member of my family is hurting, then I'm hurting too, and I want to help them. So at this moment, I'd like us to observe a 30-second moment of silence for all the victims of these mass shootings. And you can think about when this is over, I hope, what you can do, whether that's just a little more education this week, if it's reaching out to somebody. You are one person, you can do a lot, and you can affect all the red dots on this map. So we will go ahead and begin our 30 seconds of silence at this time. Thank you so much for your for honoring our family around the world and in the United States. At this moment, I'd like to go ahead and ask my colleague Colanda in Florida to move us forward.
Thanks, Kara. Thanks for leading us in that moment of silence. If you would take a look at the features at the bottom of your screen, if you're joining us via Zoom, there's a chat and there is a Q&A available. If you are going to make comments in the chat, I ask that you make it where all panelists and attendees can see it, but use the Q&A for your questions that you would like to be answered by our panelists and or live. Next slide. So before we begin today's conversation, there are some shared agreements we need to all make as panelists, moderators, as well as attendees. And those agreements are First, we want to make sure that we are fully present. We want to also make sure that we speak for ourselves and not for others, that you keep your comments on topic, that you are aware of your own hot buttons, your own personal triggers. Please make sure that you give yourself permission to move in an uncomfortable space. This is a judgment-free zone. Please recognize that there is humility in giving and receiving feedback. We want to be sure that we assume curiosity and positive intent of all statements, all thoughts. This is a safe space for first-time mistakes. Please refrain from negative or dismissive language. And above everything else, let's respect all perspectives. Next slide. So as we do these conversations every Friday, and we've added Dear Diversity as another layer, I know a lot of people are, why so much focus on racism? Why are we doing this? Why is there so much chatter, so many tools, so much focus on racism? And just as a reminder, last summer we made a public commitment to eliminate racism at Mayo and to fight any health inequities that exist. And for those who are wondering why so much focus on just racism alone, it's because racism and racial health disparities are not congruent with our values. And what an honor it is to be a part of an organization that recognizes that and it has decided to do something about it. To you, Lori.
Thanks, Kalanda. Next slide, please. As you know, we're continuing to recognize Women's History Month. And this month, in recognition of bringing awareness to the Asian crimes, I wanted to highlight a woman that I was inspired by and someone I wish that I had met. Next slide, please. Patsy Mink is a third generation Japanese American born in Maui, Hawaii. She had so many firsts. She was the first female class president of her high school. She graduated in 1944 as valedictorian. She enrolled in the University of Hawaii as a pre-med student, and after a year she decided to attend school in Nebraska. While at the University of Nebraska, she was required to live in a segregated dorm designed for international students and students of color. She was not happy with this racial discrimination. She rose to the challenge and coordinated letters, protests, and the policy was rescinded the following year. After graduation, she actually applied to 10 medical schools across the United States, and all of them turned her down because she was a woman. She was invited to study law at the University of Chicago, where she was one of 2 women in her class. So now I'm going to start naming a lot of firsts. She went on to become the first Japanese American woman to practice law in Hawaii. She became the first Japanese American woman to serve the territorial House and Senate in Hawaii. She was the first woman of color and the first Asian American woman elected to Congress, and also the first woman elected to Congress from the state of Hawaii. She served a total of 12 terms, 24 years. She also was the first Asian American woman to seek the presidential nomination of the Democratic Party and ran in the election in 1972. In 1972, she also co-authored the Title IX Amendment of Higher Education Act, Early Childhood Education Act, Elementary and School Education Act of 1965. In 1970, she became the first person to oppose a Supreme Court nominee on the basis of discrimination against women. Patsy Mink made it her life's work to serve women, children, immigrants, and minorities. She lifts me up to continue this challenge that we're facing today. I ask you all to join me and my colleagues. Laura?
Thank you so much for that, Lori. And I think, you shared kind of some of the first that she went through, but also some of the hate that she received, probably as she grew up in her professional and personal lives. And today, I think I put in the chat, usually I'm in a pretty happy, energetic, upbeat mood. But today's conversation has me in a little bit more somber mood. So please excuse me if there is, I don't seem all together today. And I also want to recognize the fact that I think for those of you who were able to join us for the conversations or the listening sessions earlier this week, I shared something on there that I want to send that same message to everyone that's listening today, as well as everyone that will be listening on future this recording as in the future. And this message is for everybody who's felt discriminated against, hate, racism, sexism, but this message is especially for my Asian brothers and sisters across Mayo and across the nation today. Um, Oftentimes, we're told in these incidents that we just need to be more resilient. And I want you to think about that. Think about the resiliency our ancestors have had to get us to where we are today. For myself, as being Hmong, I think about the tragedies of war and the resiliency that was needed there. I think about, if I go even back further, periods in time in history where my people were put in slavery. And so resiliency is part of who I am and who my people are. And then as we come to the United States of America and facing microaggressions and hate day in and day out, we are a resilient people. And so do not ever let anybody else tell you that you just need to be more resilient. You are a resilient person. We are resilient communities. And we are here to talk more about how we can work together to build on that resiliency and to address these hate crimes that we're seeing, this racism that we're seeing across the nation. And so I have three wonderful guest panelists who, at the last minute, as we pivoted this week's conversation, was willing to jump on this conversation with all of us today. And so, Kara, if you can go to the next slide, we have three guest panelists from across the nation. Dr. Koen Kim, who's the director for the Center for Asian Health Equity based out of Chicago. Bao Tao Urabi from the Coalition for Asian American Leadership based here in Minnesota. And Dr. Tali Vang, who is a psychologist with Hennepin County Medical Center. And these three women were gracefully, they accepted my extension to join us on this conversation today. So I'm going to give you all about a minute or so to introduce yourself and a little bit about the organization you work in and the work that you do. So let me start with Dr. Kim.
First of all, I want to really commend Mayo Clinic for the work that you're doing to raise awareness and to really empower your community to do the right thing. I think it's really an amazing example of the dedication that you have towards kind of ensuring equity and inclusion, and I think that's wonderful. So thank you so much for having me. I'm Karen Kim. I'm the director for the University of Chicago Center for Asian Health Equity, which is a sort of a academic community partnership with a nonprofit organization, Asian Health Coalition, together with the university to create a center that really is focused on advocacy policy, training, the biggest area research, but also to really be the voice of the community who often, as we can see, not only, as Laura said, is a resilient community, but one that's really a perpetual outsider. And we've been seeing this with everything that's been going on now. It's like, how do we become just an American like everyone else, right? And I think our center has really focused on working with direct serving community-based organizations. Many of our communities, as we know, and the patients that we serve are limited English proficient. They don't know what their rights are. They suffer in silence. And so the role of our center, similar to others on the call, is really to give voice and a platform for being able to disseminate information in a timely way and to bring information back to those who serve these communities so you understand what it's like to serve populations that may be very different than yourself. And I think that we can't do this alone. This takes a community, and not just an Asian community, but all communities to work together, to stand together, to be intolerant of racism, and to really have the expectation that we're treated that everyone is treated fairly. And that's really what my goal is with the center. And I think listening to the discussion we've had already, this is a like-minded audience, and really glad to be here.
Thank you for your spending the time today. Bao?
Hi, I'm sorry for jumping in late.
Don't worry about it.
Everybody, my name is Bo Tawarabe, and I'm the executive and network director here for the Coalition of Asian American Leaders. We are a social justice network of leaders that come from across sectors, ethnicities, and generations to harness our collective power to improve the lives of community. And so a lot of our work is really about paying attention to the community and trying to both figure out what the truth is, and then to try to figure out systemic solutions that could work better to ensure inclusion of this community. And so I would just say that there's a lot of sadness and anger and just this moment of needing to be in community as a result of, I think, both the last year of the community's experiences of anti-Asian violence, but also this sense of disappointment, right? I would say that what happened in Atlanta is not a surprise to the community. It's shocking, and we are heartbroken, but it's not surprising because we had been hearing that this was in fact the experiences of communities across the state, and that they were concerned, and that they felt that the stigmatization that was happening is what happens in histories, in our history in this country, right, around public health pandemics, around economic downturns, around just difficult moments in history. And so for that reason, I think there's a lot of disappointment, right, in the community, that we were worried that these kinds of events could actually happen when a community is stigmatized and targeted and things like that. But I also want to share that this is a community that I think does an extremely good job of taking care of itself, and that sense of both feeling like nothing will be done, and so the invisibility continues, but also the silence and continued exclusion of the community has made it difficult for the community to actually be supported, right? So much of our work is really about validating those experiences and trying to both not have to rely on just the data that we consider valid to be able to change and respond systematically. And that is a lot of our work right now. And so we are carving a lot of space for communities to be together so that they can feel like what's happened is something that needs to be acknowledged, but that we need to be working together to change conditions so that things can be different.
Thank you so much, and thank you for being here with us today. Welcome. Dr. Vang?
Hi. Thank you, Dr. Kim, Bo, for speaking about the invisibility and this concept of just being the perpetual foreigner in this country. I am very honored to be a part of this panel with both of you as very strong Asian women. And thank you, Laura, for inviting me. This is incredibly painful. But let me go ahead and tell you a little bit about just the organization that I work in. I work for Hennepin Healthcare. I'm a licensed psychologist. I work in primary care behavioral health, but I also work within the hospital system, bedside with patients. And so that is my clinical work, which allows me a very raw kind of insight into people's experiences, especially during this time. Also, within the health equity space at Hennepin Healthcare, I've been able to really speak to some of the psychological and physical consequences of racism and this chronic racism, right? And so I think that this is something that is systemically a problem. And I'll share an example. I have a good friend who is a Japanese American, and she went to her dermatologist, and her dermatologist was talking to her, and her dermatologist said to her, "Well, you know, we treat Asian skin different from American skin." And she paused, and she had to correct her dermatologist, and she said, "I am American." This perpetual foreigner, right? And it's in the language that we use, it's in the ways in which we interact with patients, whether intentionally or not. It's the bias that comes with our interactions. And so, you know, that is very well embedded into our systems and into our medical systems. And so, in these conversations today, I like to challenge everybody who's here and listening to think about how they may have perpetuated some of these biases that they hold.
Thank you for that, and thank you for being here. And Bao, you alluded to this, and this is the first question that I kind of, as we were preparing for this, sent out and had you think a little bit about is, yes, in the hashtag Stop AAPI Hate.org site, they've been tracking, right? But those are the 150% jump that we've seen the last year those are tracked incidents. There's many that go well beyond those that we have never even heard about. And even if they're tracked, don't make it to mainstream news. So what are those experiences that whether you've heard from community members or others that you might be able to share to give the audience a better and broader understanding of what is truly happening in the community?
Yeah, I will say, you know, some of the things that I have been sent or told about include people sending Asian American messages to Asian American leaders, and this happens to be a real estate agent. Someone sent her a message to say, you know, of course, swearing at her for being Asian, and then said, you know, I'm an assassin hired to, you know, come and kill you, right? And then teachers who have used terminology like, you know, China virus without thinking about how it would impact the students, right? So I think when it was heard by others and things like that, it was quickly dismissed, like, oh, you know, I didn't mean it, or things like that, because then, you know, some people, you know, mentioned it. I had a woman who also texted me and said she just went to the store with her husband, and another customer followed them out and, you know, was shoving her husband around, right? Basically saying, you know, you caused this, and, you know, you need to leave this country. And she said, you know, this time he was just shoving us, but what if the next time he runs over, you know, he runs over us with his car, or he happens to have a gun and he shoots us? There's nothing we can do if he hates us for being Asian, right? And so I think there's those types of like more egregious. In Austin, you know, a man's lawn was burned with the words China virus in it. In Bloomington, a woman was verbally attacked and then physically attacked because she's Asian and she was just balking. Um, you know, so I think that it ranges, and then of course many of our elders, I would say some of the earliest accounts that we got were elders who obviously people could physically see were vulnerable, right? And then also they knew that probably the chances are that they didn't speak English, right? So they would say, you know, just racist things or those types of things. And then we also heard, because during the pandemic, a lot of things were closed. And so, you know, Asian small businesses telling us that they really felt that customers were not going because they were an Asian business. And then also people who went into stores where they were refused service, right? Like a cashier telling them to go to a different lane. So I would would say that the totality of that is both the emotional toll that it takes on the community, but also to see that racism is not just this egregious form of killing someone. It really happens in that spectrum of targeting, right?
Mm-hmm.
Where people are made to feel scared. They are intimidated. They are constantly told, right, that they're not American, that they're, causing something. So, I give those examples because it's important, because I think Atlanta, and then the after effects of Atlanta, what traumatized the community even more, right? Where we gave so much benefit to the killer, and we said, well, he said it wasn't race, so it isn't race. Like,
You're just having a bad day.
yeah, he just had a bad day.
Yeah.
And so stuff like that, that really, I think, angered the community and re-traumatized the community even more, because how could you go to 3 Asian businesses and then say that it was not anti-Asian, right? So
Exactly.
I think it's stuff like that where the community feels silenced, right? That not only do the microaggressions happen, but that there are constant instances of anti-Asian violence that happens, and that it's also not just at the interpersonal level, but the fact that sometimes systems don't do the best that they can. I can't tell you how many people have emailed me since Atlanta feeling the disappointment that their employers did not acknowledge what happened, right? So Asian employees feeling like they didn't get a check-in, nobody asked them how they were doing. Nobody acknowledged that this might be a moment that's difficult for Asian Americans.
Thank you for sharing those stories. And like I said, it goes on said, it goes unreported, right? And so, Dr. Bang, Dr. Kim, I'd love to bring you both into this conversation, thinking about that, uh, you know, well before COVID, obviously. And I remember Andre Koen, who's a colleague of mine here on the team, the very first one of these shows that we ever did about a year ago was on stigma and discrimination and hate, right? And so this has been going on well longer than just 1 year, but now we have a track record. So what's the impact on both the individual and the community? Bao alluded to that. What's that impact like from a psychological perspective? And then eventually we can get into that whole health-wise, physical health, and the inequities that exist. Either one of you want to jump in? Perfectly fine. What's that psychological impact as you see these things day in and day out?
So, Dr. Vang, you might want to start, since I think you're probably seeing this both in the hospital, but also just in general, given your profession. Kind of the mental health toll is enormous, right?
Yeah, absolutely. I can jump right in. When we talk about the mental health kind of impact of racism, I think acknowledging that this has been ongoing is incredibly important, but also acknowledging just the weight of all the layering of everything that's been going on. So our Asian American communities have been losing family members to COVID, and we've also been experiencing the economic impact, and there is just our own anxiety of not wanting to get sick. Having to deal with children staying home from work. So there's all these compounding things on top of being afraid to step out of the house. And so there is there's definitely increased anxiety generalized because of all the things that's going on. So even if people have never felt anxious before, right, they're noticing that they are feeling restless. They can't eat. They can't sleep. Some people are in response to that, some people are turning to ways to cope, which, that can result in perhaps substance use or wanting to reach out to community members, in which, our cultures really emphasizes our communities, and we can't really do that during COVID. That's been incredibly, incredibly hard. And so when we talk about that, we talk about increases in depression. But I think it is incredibly important that we do highlight trauma here. And so the traumatic impact, it has because of the intergenerational traumas that our cultures, different community members, there's a lot of diversity in our Asian American communities, but each different ethnicity has their own trauma history within this nation or it's related to this country. And so there's a re-triggering of the traumas. There is this ongoing distrust for this nation, for the systems, because of the violation of of our cultures and our community members. And so there is this hypervigilance that we have to deal with now, right? Of where we're always kind of keeping track of our safety, our surroundings. We don't know what's safe. And when we couple that with those that are working right now, you go to work and there's this silencing, and we're expected to show up, and we're expected to do our work as if nothing is happening and no one's talking to us. And we don't even know if our colleagues feel this way towards us. That's incredibly, incredibly difficult. So those are some of the psychological impacts, and I can talk about the physical impacts later as well, because it bleeds into each other. But I would just want to check in with Dr. Kim too to see what else you might have to add.
Yeah, so I work with a lot of young people and college students, and what I'm seeing is kind of really two different responses to this. One is sort of retreat. I'm scared. I don't really know what to do. I would like to be more invisible. I can't get away from this, right? Because the microaggressions, the feeling of made to feel guilty, kind of just the media, just the whole system that allows sort of this systemic racism to continue. The other response is, I'm so angry and I want to do something about it. And so this anger that set in without having any power to do anything, without systems be able to support kind of big wave movements, so I see that the students, they're really kind of on really polar opposite ends of how they want to respond. And those students are angry at each other. For those students who retreat, the students who want to be empowered and do something are angry. For the students who are scared, they don't want to shed any more light. They really want to be invisible. So it is just a really terrible situation in terms of what's the outlet and how do we change the system to allow there to be a safe space to have these discussions and to also to do things more proactively rather than reactive. We're in such a reactive space. This is not new. We've been seeing crimes, hatred towards these populations for since we've arrived in this country, right? And I think what you've said about these intergenerational trauma that gets passed on, it's also really important to understand, where are you coming from as an Asian American in this country? Are you a refugee? Are you an immigrant? What is the history that brings you here? And what is that relationship then that you have with this country? How do you see yourselves here? Certainly we know how other people see us. They see us all the same, right? But really such different communities, and our ability to respond are very, very different. And so I think this is sort of our time of reckoning, right? I mean, this is our opportunity. Finally, we're getting more social media presence. We're getting more mainstream media acknowledging that there's a problem. And so we really need to find our voice. This is sort of our moment to, unfortunately, to have to find our voice collectively.
So on one of the conversations or listening sessions earlier this week, we talked, and someone brought up the idea of the model minority, right? You all are familiar with that. Does that help? How does that help? How does that hinder our progress in this work?
Well, I suppose I would rather be, so for those of you who are on the call who don't know what the model minority is, it's really sort of attributed to, it's in some ways stereotypes of Asian Americans that all attribute only good things, like we're smart, we're hardworking, we don't cause any problems. And so the problem is it causes a lot of animosity from other minority groups because they use us as like sort of the model, like, why can't you be like them, right? And so it's really a problem. From a student perspective, it's a real big problem. And I think if any parent of an Asian child will probably know that somehow if your child does something well, it's their Asianness. It's not that they've worked hard, that they've deserved anything, that they so if your child, my kids used to bring home something, and if they did really well, the teacher would say, well, obviously you did well, you're Asian. That minimizes all of their hard work, and it's actually really demotivating. So I think this model minority is it's actually very harming to the community. It really minimizes the work that actually goes into having accomplishments. The other thing is these communities, there are many communities who are not model minorities, right? That they are undereducated, they're underserved, they need resources. And if we don't have that data, then there's no evidence of the need for policies that inform improvement for these communities. So I think it's actually a very damaging sort of stereotype.
I would agree with that. I think that the model minority myth is incredibly harmful in that it centers whiteness. And what I mean by that is it makes people want to align with whiteness. And the more I can become white, the less I'm going to be in the spotlight for anything that's negative. And so in the Asian American community, it can also create divisiveness, because if we could just try to be white, try to be educated, try to be on the higher tier of like social economic status and speak English clearly, then I won't be targeted. I won't have to be treated differently. And that is a myth. And so it becomes very harmful in that it tears us apart as a community, and we can't be a cohesive unit.
Bao, anything to add to that?
Sure. Well, just a few things. I think, Dr. Kim and Dr. Bang both said really the gist of it, which is really we have to understand the historical context in which the model minority myth was created, right? That it was really created out of a need to not respond to the demands of Black communities, right? That the model minority myth was created to demonstrate that there was actually another population of color that was succeeding. Because remember, before this, Asians were directly connected to anything that was disease ridden, right? So that was our past. But in the moment where Black communities were demanding for equality and demanding for more systemic change and investments to their communities, the model minority myth popped up, right? But before that, the image of Asians was not what we understand the model minority myth to be today. So I just say that because I think that we don't have clear, oftentimes, and truthful histories about race in this country. And it takes so much of our own desire to learn and interest to learn all these things so that we can actually know the truth about how race impacts all of our communities, right? And then I would just say that yes, the model minority myth indeed both silences the communities, because it makes this generalization and assumption that is harmful, because not only are the needs unseen, but the assets are unseen, right? We don't want to just be talked about in terms of communities who are suffering, but if we are doing things well, that's not seen, right? And then I just also say that uh, none of us are one dimensional. That's why these stereotypes are harmful, right? And so I know that in Minnesota, where we have great diversity, just as any other Asian populations across our states, it's really, really diverse. And there's a lot to be said about that, that if there is success in the Asian community, it is through hard work. Yes, people's personal hard work, but it also has a lot to do with who we allow to come to this country. So then we don't make these systemic connections that our success is not because Asians are working so hard and we succeed. It's because we allow certain kinds of Asians to come too, right?
Right.
So we can't then have these more intricate conversations that are more systemic in nature. And I think that the community understands that, and that's why it's been so problematic, right?
I see Andre raising his hand, and I want to bring the rest of my team in here, who has been monitoring the Q&A and the chats. So Andre, go ahead.
Yeah, so I want to say thank you so much for inviting this notion of solidarity and giving a better, especially Bo, thank you for that contextual piece. This question actually, I'll open it up to anyone, but more so for Dr. Vang. As a person who wants to stand in solidarity, and I perceive myself to be an ally, but I wait for other people to confirm that, right? Um, when I hear statements like, I understand what is going on with your particular group, and and I feel bad about that. But what about me and my group? What might be some tangible ways to help folks psychologically deal with um, the fact that sometimes it's not always about you, kind of thing. What have you
And it's
found to
not a
be helpful?
competition, right? It's
Right.
not a competition. Racism is not a competition. It's not a degree of whether or not your people, your community is facing racism at a different degree than mine. So go ahead.
Mm. I would love to address that question. Thank you for that question. I think that is something that I've definitely been seeing in many different communities. This is what I'll say to that. That is the scarcity mentality. That is, we are led to believe that there are limited resources at the top. And so if you got yours, you got to hold on tight to it. And if anybody encroaches, you need to beat them down. And that is the tool of colonization, right? That keeps us divided and separated. And if we get lost in the weeds, then we're not able to see the system of oppression that we are all a part of. We're talking about systems. We're talking about a system of oppression that's keeping our communities divided, right? And so we need to keep that in mind, and we need to actually take a bird's eye view of everything that's going on and understand that our pains are interconnected. It's not the same experience, but we experience pain from being marginalized, from being oppressed. And so if we come together and we see it as we're fighting the same system, then we can have that power to continue to help each other out. And it's that flexing, right? It's that flexing of time and space and energy and supporting one another that is critical here.
I would definitely agree. This is not a zero sum game. This is and to create that type of structure where one community is pitted against each other. This is the system doing this, imposing this upon us, and that's not the way we want to approach this. And so, allyship, working together, we're all trying to get to the same place, right? We just want to live in an environment that is fair and equitable, and that we can be treated with respect, right? And I think that's all communities, right?
Yeah.
Kara, oh, go ahead, Bo.
Oh, I was just going to add that I think um, there is the very simple act of just recognition, Andre, right? That sometimes when the community talks about its pain, all you have to do is just to recognize it and to name it, and that is an act of solidarity in itself. Now, when it comes to systemic solutions that I think Dr. Vang talked about, to ensuring that we know, living in the richest country in the world, that there should be enough, right? That we should not have child poverty, we should not have homelessness, we should have like all the things that should enable our communities to be thriving. Like we can do something different, right? But I think that oftentimes the challenge is when it's just a personal response, and then we can't get beyond that, right? So I would just say, it's really important that practices of solidarity are supported, because I also say that we are often kept in our silos, right? I talk to Asian Americans who sometimes feel like, well, I don't want to support that because it doesn't have Asian in it, right? And so then I have to tell them, well, it doesn't need Asian in it because the intention is really about about everyone. And so, over the decades and years and generations, our muscles for solidarities are not always there, and it's really important for us to to not just use the words, but to actually be practicing it daily, right? And to be practicing it from the personal level of both just being present there for your colleagues. That if you had such a tragedy, that someone who identifies as a part of that community must feel a certain way, right? Because you know you would. So how are you there? And then systematically, how do we now look and take the abundant view of saying, well, if we could actually take care of everybody, what would that look like, right? And how do we um, how do we do anti-racism work that is inclusive of Asian Americans? Because one of my greatest challenges in the many years that I've done this work is oftentimes people are like, what? Asian Americans doing anti-racism work? Like, how's that work, right? So and I say, well, if you're addressing racism, then how could you not be inclusive, right? So yeah.
Yeah, thank you for that. Kara, anything from the chat, from the QA you're seeing as you're monitoring?
Yeah, Bo, you said it's a very powerful thing when somebody sees somebody, and that's something we heard in our listening sessions this past week. We had one attendee who said, "I'm didn't know." She said, "I didn't see before." Thank you so much. So folks are learning how to move forward, but they're afraid. They're making that transition from the golden rule, treat others as you would want to be treated, to treat others as they want to be treated. And they're not sure how to do it. They're afraid. They don't want to hurt somebody. They don't want backlash. There's sometimes sometimes they're defensive, sometimes they're inactive, and we're trying to teach and encourage our listeners today to move forward in an uncomfortable space. So, in keeping with that, one of our Q&A questions is, how can I reach out to my Asian coworkers and friends that I really don't know before, and I've never addressed this with them?
Well, I think probably Dr. Kim and Dr. Vang are better at and can give better recommendations about that. But simply I would just say, ask, right? How are you doing? And I have had so much generous gestures in this time, and I'm grateful for the community that I've been able to build around me who know both to just say, I'm thinking about you. This must be a difficult time for you. To also say, what do you need, right? How can I be there for you? To actually just sending me food coupons because they know I've been working like crazy during this time, and things like that. So I think one is the act of being seen is just asking, and to be unafraid of what might come back, because some people may not want to talk to you about it right then, right? But I think that I can guarantee the fact that you ask will make them feel like they have been seen, right? Now the response, I will leave up to Dr. Kim and Dr. Vang to give more, recommendations. But I think that it's just, yeah, just engage.
I would like to speak to how you might help, how you might reach out. And I think that the term practice makes perfect goes really far. And that is when we talk about like psychological interventions, exposure, you need to keep doing it. You keep practicing. You keep talking and checking in like Bo was talking about. And regardless of the reaction that you get, knowing, it's not for all of us. It's not if we make mistakes, right? When we're engaging in anti-racism work, we're all going to make mistakes. It's when we're going to make mistakes. We just need to be able to continue to get back up and work on ourselves and work on improvement. And so being able to step outside of your comfort zone, asking how people are doing, that's going to be incredibly important. And related to that, intervening. There are so many hate crimes where bystanders are not doing anything. That hurts, right? Especially because there's oftentimes many people around. If you see something, if you hear something, intervene. If you're afraid for your safety, there's a way that you can intervene that can keep yourself safe. That is, pull the person that is being victimized and say, would you like me to walk you to your car? Or approaching the person that's been victimized and say, hey, I saw that just happened. That's not okay. Are you okay? That makes us feel like we're not crazy, right? Oh, that cashier just looked at me weird. That cashier just used sanitizer after I like walked right through and didn't do that with anybody else. Say something. I saw that too. I see you. That goes a long way.
So, Dr. Kim, in keeping with what Dr. Vang just said, somebody asked in our Q&A, does approaching someone and asking ever make you feel, could it make a person feel suspicious or just a little paranoid after everything that's going on? Why are you asking me if I'm okay?
Well, I would say that um, what Dr. Bang said about practice makes perfect. I think I think there's so many people in our collective community that are really looking for allyship, support, being seen, not being visible, and actually a safe space to sometimes have a conversation, which I don't think we've created very well for Asian Americans. And so I think, and also for the person who's approaching, if you're doing it, and just decided, I don't know my colleagues here who happen to be Asian American, I'm going to reach out. Be forgiving of yourself if it doesn't work out well, right? If the response is not exactly what you said, if it comes across kind of in a way that maybe not how you meant, I think you also have to be kind to yourself in trying to be an ally. It's not easy to do because sometimes someone will say, well, you don't have any idea what I'm going through. That, I think you have to be forgiving of yourself. I think that reaching out to your colleagues and being able to try to have these conversations are really important. And sometimes it's just like, I don't even really know what I should be saying. I just know that I feel bad for what's been happening. And just let that, I think that kind of acknowledgement is great, right? Because, it's a huge start. But I can't emphasize enough intervening when you watch something happen to any community that's being disparaged or marginalized. I think we have to, as Asian American communities, stand up and be better allies. I think for all communities, there's not enough intervention that happens when we see people being treated poorly. And we have to be able to step up and say something.
So those are great tips for the individual, right? But we also know that we live and we work within systems, and all three of you brought this up earlier too, that to do anti-racism work, which we will get to another conversation another time. Um, what do we as healthcare systems need to be aware of to do to really start to address and to partner with folks like Bo and the folks who are doing social justice work in the community? What are some of those things we need to do as healthcare systems to start to break down racism and start to address equity?
Well,
I was
go
going
ahead. Go ahead, Bo.
Sure. Because I was just working on this report. I can just share. Well, we really encourage using disaggregated data to the extent that you have it, and probably in the health system you have the most. Because we're finishing just a short brief about the disproportionate impact of COVID infections and death in the Asian community. And specifically, it is hitting the Hmong, Karenni, and Karen community in Minnesota. And we can even go down to the zip codes and know that the majority of death and infections have happened there, right? Now, if you just looked at the state data, you're like, oh, pretty like this is a population that obviously is dying and infected at a higher rate than whites, but not as bad as some of the other communities. So we don't need to pay attention to them, right? So I just want to encourage you to the extent that you have information and can get down to the complexities and the nuance, to be unafraid of that, because that's going to make you better providers and systems. The other thing is really to value your bicultural, your bilingual people, right? That it's really investing in this that will make everybody, all of your patients and communities know that you value who they are, right? and to not just celebrate us during Asian Pacific American Heritage Month, but you have this breadth and depth and diversity within your organizations, and how do you actually acknowledge and do that? And then, you know, also to continue to educate your workforce about different communities, right? We don't have to wait for the next crisis to do better in terms of what we do in terms of educating our workforce and supporting that. And then to actually have programs that support your employees. I have heard from a number of doctors who have told me during this period that their patients requested to see someone different because they were Asian, right? And so that kind of micro, I mean, the clinics have to respond when the patient requests, but when you intimately feel like that patient did not want to see you because you're Asian, it does something to you, right? So you may not say it, but then that person is going around carrying that emotional labor, and I am not sure how many of our employee, care services understand how to actually support individuals in a both culturally competent, but also in a way that understands race. So I want to just encourage, use disaggregated data, value bicultural, bilingual staff, invest in training for your people, and make sure that you have support for your staff when they're going through things.
Thank you. Dr. Kim, you were going to jump in too?
Yeah, I was just going to say, I think data is really essential. And then when you have data, believe it, act on it. You know, we have so much data and we're like, oh yeah, okay, we're not even going to do anything with it. So act on the data. The other thing is, from a system perspective, you know, I think it's good to also take a look at who are your leaders, and where's the diversity in leadership, you know, and I think that's really essential, because I think that's a really big commitment. And take a look. And if there's not that much diversity in leadership, change it. You know, sort of make the pipeline to change it. You know, language is a really big issue, and I don't know at Mayo how many people are limited English proficient that you see, but certainly it's important to know that. And so that kind of data is important. So when people are coming in and they don't speak English, there's interpretation present. And I always tell my trainees, just because someone doesn't speak English doesn't mean they're uneducated or that they're hard of hearing. So and I say the hard of hearing because I always hear my fellows screaming at the patient as if somehow speaking louder will make them understand.
Nope, never works.
So, you know, I sort of say that in jest, but I think it's really important. And I think these type of programs where you're actually inclusive of Asian Americans is a huge step forward. I don't know, Dr. Bang, do you have?
Yeah, a couple things. I think systemically, I'm a huge believer in and advocate for education, and I think that there needs to be systemic implementation of education all across the staff in terms of implicit bias, how it impacts health outcomes. There's a lot of data, a lot of research that talks about that, and then also being able to have concrete, practical steps to decreasing implicit bias. I think in addition to that, being able to create, and I don't know that if Mayo already has this, creating a process where when people are discriminated against, they have a reporting process. I think that oftentimes corporations have a hard time doing that because they think that, oh, if we make this an issue, if we create a process for people to file complaints of racist acts, then it's going to blow up. But the truth is, a lot of data suggests that people don't actually jump to saying that race is the issue. Most people try to over-explain, right? It's this whole gaslighting thing. Oh, it must be these other things. I must have done something wrong. Racism, when we call out racism, it's oftentimes the last thing because it is a heavy claim to make. And so being able to create systems where people can say, you know, so-and-so discriminated against me, and then being able to address that can be incredibly helpful for staff and for patients.
Well, thank you, Dr. Kim, Dr. Vang, Bo, all three of you. All the insights you provided have been invaluable over the last 45 minutes or so here. It has been a pleasure to have you on the Everybody In conversation here at Mayo Clinic. And I'm going to bring my colleagues back in to help me wrap up the conversation today. But please feel free to reach out to us. Well, first of all, please feel free to stay for the after show. We have a little bit of after show just to extend the conversation a little bit. But please feel free to reach out to us in any way we can do to provide support in the work that you're doing.
Thank you.
Thanks for having us.
Andre?
Yeah. So
Oh, you're muted.
oh, I am muted. So let's go to the next slide because we want to make sure that everybody knows that we have resources that are in this slide deck. You can go to the website and video exchange to view this again. Next slide, please. I think it's also important to uh,
Go further, please.
Yep, go further. I want to get to the Everyday Inclusion app, so please download this app. You can get the code if you don't have it, and you want to be a better ally. Excellent, excellent, excellent tools. I know I'm stepping on somebody's toes in here, so my colleague that wants to jump in, please do. Otherwise, I'll just bring us out. But the code is in the chat, so please download this. Tons of great resources. Next slide. Colanda, you want to take this?
Yes, I will. So, in addition to our Friday conversations, we have started what we call Dear Diversity. Everything you ever wanted to know. It is a more informal conversation, but is where we address those Q&As that we could not get to during our Friday conversations. And we also have an opportunity to go to Slido.com, use hashtag Dear Diversity to 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 enter any questions that you may have, and we answer them live on Wednesdays. We do it twice every Wednesday. Next slide. And to take us out, enjoy this musical selection. Thank you so much for tuning in. Stay for the after show.
I can sing if you want. I'm not sure if my voice would be as good as the original singers, but I can. Seasons of love is here. If you seasons of love. So, I guess that's not the musical selection that we're supposed to be hearing. Is that right, Laura?
Yeah, I don't think we have big enough for an acapella session with Andre, but that's okay.
Right. So we will.
That's okay. We'll just take it out. And thank you for those of you who are able to join us today. We will call this will be the end of the official conversation. So Karen, go ahead and take down the PowerPoint. That's perfectly fine. And we'll go just roll into our after show. So
Actually, it was me that had that, and I didn't share my sound, so my apologies to
That's all
everybody.
good.
Kara lost power. So,
oh, gotcha.
So no, it's
No problem, Lori. That's perfectly fine.
Andre, you should have kept going. That was amazing.
That's my shower. I sing best in the shower. Acoustics are the best.
Yeah, that would be hard for a Zoom call, but your acoustics were great. Dr. Wang, Dr. Kim, I think she's no longer here. Both, thank you so much. That was just amazing insight. Everything you shared from personal, your lived experiences, but like professionally, what you see, the tools you shared, the framework you shared, it was just spot on. So thank you so much.
Thank you. Thank you all so much. I have to get going as well, but thank you so much. This has been a wonderful platform. I've learned so much from you all as well. It was a pleasure just being here and being able to share.
Hey, before you go, tell NECA I said hi.
Oh my gosh, I will. Okay, I will.
All right, see you. Thank you again.
Bye.
All right, team.
So Laura, I know we did not get to the health parts of what we wanted to talk about. So it looks like this could be another conversation to kind of talk about that as well.
Certainly, I think they alluded to it. All three panelists when we talk about disaggregation of data, right? That has been ever since I got into doing doing D&I and healthcare and health equity work, that has been the thorn in this work for API communities forever. That the inability for healthcare systems to disaggregate that data, even when Governor Dayton in the state of Minnesota came on early on in his tenure. There was even a group of community leaders and healthcare professionals coming together and proposed to him, we need to push this forward to disaggregate data, not just for Asian communities, but for many communities across the state of Minnesota. Asian Pacific Islander, sorry, API stands for Asian Pacific Islander. And we're still there, right? This is, oh goodness, 12, 15 years ago.
Yeah.
And we're still talking about this disaggregation.
I think there's also regulatory issues around that, Laura, as you just mentioned. Globally, I mean, there is ethical regulations, which actually differs not just from country to country, but also, there's ethical considerations. There is still a significant number of our patients or employees, for example, where, who do not wish to disclose race, ethnicity data. So, Laura, to your point, like, this is just so hard. We all want this data to make that meaningful change, and we want to do this collection of data in with a culturally appropriate, with a lens of humility and under regulatory issues. And for us being across sites, like if we talk about Mayo Clinic data, there are ethical standards of how we collect data. And globally, this thing, I mean, I've honestly listening to other leaders within D&I across countries, there is still no consensus. And, it's a conversation that's ongoing, which makes it just harder. But at least for us, I know our HR group and the data analytics team is really helping with our office wrap our arms and heads around the disaggregated data that we can get. Because data can be disaggregated in so many different ways.
Yeah.
What are those ways? I think the other thing we've talked about this, Laura, is really utilizing quantitative data carefully. When we get data, we want to know, is the data completely inclusive? Do we have appropriate qualitative components in the data? So what we gather from our Friday conversations is very different data than what we would be able to gather, like if we just counted numbers across Mayo Clinic, right? So it's that balance of qualitative data and disaggregated data. That was an excellent point. Go ahead, Andre.
Yeah, one thing I did want to, I wanted us to kind of think about in this forum, and I didn't get a chance to because the conversation was just really rich and it was dense and it was emotional, and I can't. Yeah, so I'll just say it. So part of the struggle that we wrestle with is for our white colleagues who say, "I'm hurting too." Like, how do we navigate that space without distracting from somebody else's turn? Like, turn is a bad way to kind of think about that. But how do we say, yes, you have some pain, but like this Olympics thing of trying to measure who's got the greatest pain isn't getting us anywhere. So can we spend some time on this, and then we'll spend some time on this, and then how do we help many of our white colleagues who are like, when do we get our turn? Like, I don't know if I'm saying that right, or if anybody else has experienced that in terms of how they've related with folks.
I've heard it from multiple minorities, not just our white colleagues, but especially our white colleagues. Yeah.
So I think we've been talking about this on this team, in our team huddles, and as we continue to plan for these conversations. But this idea of helping our male colleagues understand what's the difference between your traditional diversity, equity, inclusion work, right? Which is about getting everyone together and kumbaya and whatnot. But then when you talk about and get into the work of anti-racism, that looks very different, right? And so I think, we were talking about this on the team call yesterday or the day before, just planning future sessions like this. And I think that would be a great conversation to have. So participants, if you're still listening, give me a thumbs up if the difference between DEI and anti-racism is something you'd love to hear.
Andre, I think one of the takeaways from the call today for that pain, which looks different for different groups, I loved how Dr. Wang explained it on how pain is interrelated. Like our pain is interrelated. Yes, it's different for, let's say, me or Andre or Lori or any one of us on the call, but it's all interrelated. And pain is not a good feeling for anyone, irrespective of how we look and where we come from. And I appreciated like Bo's framework of approaching this with a systematic abundance view. And I think there was a comment about how do we increase the size of the pie, which was so deep. And one of the frameworks I think that disability work has used, the BDF scheme, where there is breadth to this work, there's depth to this work, and an appropriate frequency, the BDF. I wonder if we could, this would be great lore for us to start creating like nuggets of takeaways from today's conversation. And by the end of the year, we'll have a new framework, which would be crowdsourced by our attendees and all of our
the
colleagues.
panelists. Yeah.
And
That's good
panelists
stuff.
and colleagues. So this would be a collective sort of like our toolbox that we generated from our Mayo family and analysts.
I appreciate Andre's direction where he was talking about white people pain, but I'm hurting. I'm hurting for my colleagues that I'm sitting with, and I'm hurting for our communities. And so my pain is different. My pain's not about what about me. My pain's what about you. And I feel so at times inadequate in making a difference in the lives of others that I respect and the systemic racism and all those pieces. And I'd love to explore more as a person who wants to see things change, more calls to action or more direction that I can really influence as a white individual. Um, and maybe some of that reflects back on me as a white individual, but my actions want to be directed towards changing what happens.
Mm-hmm.
Very good point.
Well, folks, it is near.
Slightly more.
Sorry, Kabuika, did you have something?
Correct. But it sounds like more material for the next for a future conversation on the topic with allyship resources.
So before I call it, people who are listening, if you have ideas for other shows that we should be covering or other tools and resources that you might need to be able to step into this work, to do this work even better than what you already have tools and resources for, quickly type it in the chat, because all that will be captured, and then we can use that for future planning. But team, this has been a wonderful conversation. I'm supposed to be on PTO, and my wife and kids said, nope, you have to be on that call, not only for you, Lord, Dad, but also for us. And so it was a powerful conversation. My daughters were listening as well as we were going through the conversation, and it was powerful for them too. So thank you so much, and thank you for all the work you do day in and day out and every single week and the last year. So Kabuika, I think you have a great idea for us to end it with the Seasons of Love.
Thank you all.